All right, so thank you for now. And while we wait for you to get seated, I turn to our Choi Min-jung for more local COVID-19 coverage. Min-jung, welcome.
Thank you for having me.
Right, let's begin with details from the emergency meeting presided over by President Moon Jae-in on Korea's COVID-19 situation.
Right, Sunny. On this Monday morning, President Moon Jae-in chaired a virtual meeting of the Central Disaster and Safety Countermeasures headquarters for the first time in 7 months. During the meeting, he emphasized the gravity of our current situation, saying it's difficult to predict how much more infections will spread or when it will reach its peak. He added that while the country needs to remain vigilant, there is no need to panic as long as the public and healthcare workers continue to cooperate. Moon also underlined the importance of our Omicron-tailored medical response, including the roles of local hospitals and clinics.
전파력이 강한 반면 중증 화율이 낮은 오미크론 특성에 맞게 속도와 효율을 높여 고위험군 관리에 역점을 두고 위중증과 사망 위험을 막는 데 역량을 집중해야 할 것입니다. 확진자 수가 증가하더라도 위중증과 치명률이 안정적으로 관리되고 의료 대응 여력을 유지해 나간다면 성공적으로 이 고비를 넘어설 수 있습니다.
Right. Min-jung, meanwhile, do tell us a bit about the prevention guidelines in place at private venues of learning starting today.
Right, Sunny. Starting Monday, venues that do not require the vaccine pass, including cram schools and study cafes, will enforce stronger prevention measures. At places of learning, people must sit 1 seat apart if there are no partitions in between seats to minimize contact as much as possible. There will be a grace period until the 25th, so until then, people won't be fined for violating these rules. The new measures come amid growing concerns over the increasing number of infections among teenagers. Currently, 1 in 4 people who have contracted the virus are under 20 years old. A closer look at that figure shows that 10% are under the age of 10 and 15% between 10 and 20. Experts have predicted that the number of new cases in this age group could reach 30,000 a day by the end of this month.
Right, 30,000 a day by the end of this month. And because of such predictions, I understand they have prompted Seoul's education officials, SOA, to address containment efforts within the academic arena, right?
Right, Sunny. So Education Minister Yoo Eun-hae just held a briefing on how the Education Ministry is going to deal with these Omicron cases that are rising. And what many parents and students have been asking themselves is whether they can return safe to their new school year, which will kick off in weeks from now. And the gist is, first off, in-person classes will be made available in the next coming weeks, and that goes for elementary, middle, high schools, as well as university students. But what the education minister said is that schools can make their own decisions on whether they want a mix of in-person and online classes, and that depending on the severity of the situation within the schools, if, for instance, they have a certain amount of percentage of kids that have been infected. And also what the minister said is that they will make test kits available at school education facilities because now PCR testing is not as easy as it has been earlier. So they will make those test kits available, as well as more KF masks at schools. And another thing that the minister mentioned is that between February 14th and March 11th, there will be a special prevention period where the schools and education officials will check the prevention situation at education facilities.
Right, I see. And staying with such prevention efforts, Min-jung, aside from places of learning, are there any other changes in our social distancing guidelines starting on this Monday?
Well, it's not much of a change, but social distancing measures have been extended for another 2 weeks starting today. Until the 20th, the social gathering cap will continue to be limited to 6 people, and most businesses like restaurants and cafes will have to close by 9 p.m. Also starting Friday, department stores and supermarkets won't be allowed, starting Monday that is, department stores and supermarkets won't be allowed to hold promotional events, and eating will also be banned at these locations. Like the new measures implemented for cram schools, as I mentioned earlier, there will be a 3-week grace period. Meanwhile, the age requirement for oral COVID-19 treatment will also be lowered from today. Pfizer's Paxlovid had only been prescribed to those aged 60 and over, but now people in their 50s have also become eligible.
Right, and Min-jung, staying on the treatment front, I understand the government is mobilizing more local clinics to test and treat COVID-19 patients. Tell us more.
That's right, Sunny. Health authorities have designated around 300 more local hospitals and clinics to conduct rapid antigen tests and treat patients. This brings the total number to 780 medical centers nationwide as of Sunday. Combined with the number of respiratory clinics there are a total of around 1,100 hospitals and clinics providing these services nationwide. Although the government is doing its best to expand our medical capacity, there are concerns that the measures are struggling to keep pace with our current surge. As of Monday, close to 146,000 patients are being treated at home. This is 88% of Korea's current capacity, which can handle 166,000 home treatment patients. With the rapid increase in infections, the country's healthcare system faces a difficult task of delivering oral pills and home treatment kits on time and in sufficient numbers.
Right, I see. Min-jung, well, thank you for that report, and I'll see you back on Tuesday.
Thank you.